This podcast is intended to provide information for educational purposes only and to serve as a starting point for you to have a conversation with your personal physician. Nothing stated on this podcast should be considered medical advice. Consult with your physician before undertaking or changing any treatment plan.
Welcome back to the Pound of Cure weight loss podcast.
We just changed the name to that. Just now,
Well,
at this very moment.
We changed it in this moment, live here with you.
We realize that nobody knows what the Pound of Cure podcast is about. And I know when I look at podcasts, I look at the title and, that's what that's what I want to learn more about. So we just now renamed the title to the Pound of Cure Weight Loss Podcast.
Yeah, tell all your friends.
Zoe did it. It's done.
And we are on episode 10, Why Your Meds Cost So Much. So we've got a really packed episode today. But did you know only 8% of podcasts have more than 10 episodes?
I'll tell you, I think we're onto something here.
I'm excited. It's good. We're already in the 8%.
Yeah.
We also now are in the top 15% of all podcasts, which I'm impressed by.
All active podcasts.
Active podcasts.
Yeah, all active podcasts.
So to keep that ranking going, tell all your friends, tell your family, spread the word. I think that, we have so much value here. And if you find this valuable, we definitely would appreciate you sharing the word as well.
Absolutely. Our goal is really to provide science-backed information about weight loss, taking all the stigma out of it, providing a good kind of common sense approach to losing weight that really takes the stigma out of weight loss surgery, out of the medications, and also out of the nutritional changes, and just comes up with something that works for patients. And so that we're looking at obesity like we look at every other disease.
No bariatric patient left behind.
That's right. No GLP-1 med patient left behind. That's our goal. We want everybody to understand that physiology plays a huge role in weight gain. And if you're going to solve this problem, you have to take a physiologic approach. And that's what this podcast is about. On a different note, our practice is growing. And we are hiring. We're looking specifically for nurse practitioners or physician assistants. We do have room in our practice for an additional one. We're growing very quickly. We're really only limited to seeing patients in Arizona because of medical licensing issues. Our hope is ultimately to grow beyond that, and we need more staff in order to do that. So if you are a nurse practitioner or a physician assistant, want to join a rapidly growing practice with its own podcast. How many of those are out there? Let's be honest. Please give us a call, reach out, call the office, ask to speak to Sierra, our office manager. I also wanted to share that on 2 episodes ago, we talked to Kim and Larry, and they were both struggling to get their Ozempic approved. We actually have gotten Kim's Ozempic approved. I spoke to her the other day, and she has received her medication. So there is hope for those of you who are facing denials out there. So anyway, Zoe, what are we going to talk about this episode?
Yeah, like I said, we've got a packed episode. We are going to be talking a lot about drug costs, why they're so high, and who's to blame. Yeah. I think everyone will want to know about that. We do have a patient story. We've got another guest, which we're super excited because she actually has a fabulous way of getting her kids to eat more vegetables along with herself. Easy. So, and she's also going to discuss the privacy around her decision for having surgery. And I think that's also a very important component as well. And that's perfectly fine to have that privacy. So she's going to share a little bit more about that. We have our, of course, nutrition segment. I'm going to share with you a hack for getting more veggies in, making it more convenient to eat your vegetables, as well as our questions from our listeners, weight regain after surgery, specifically the gastric sleeve, metformin, and then staying on track with nutrition while traveling, specifically those first couple months after surgery.
Fantastic. All right, great episode. Well, let's get started. Our first segment is the news. And this article comes from Money Watch, and it talks about how drug makers are hiking the prices of more than 700 different medications starting January 2024. Ozempic and Mounjaro are both on this list. So in order to understand drug costs, you really have to go way back. When you think about commercial payers, we all think, oh, well, there's United and Cigna and Blue Cross and Aetna, but it breaks down much, much, much more granularly. So there's like 150 different flavors of United Healthcare or more. And the same can be said for Cigna and Blue Cross and Aetna. So there's all of these tiny policies, and they're each kind of trying to create their own contracts with the pharmacies and with the medication manufacturers in order to price out the medications fairly. And so immediately we don't have these kind of big players. The only big player out there that would have the power to really hit the pharma industry hard and negotiate with the pharmacies and the drug makers in order to lower the cost is Medicare. However, if you go back to 2003, G.W. Bush signed the Medicare Prescription Drug Improvement and Modernization Act, and it went into effect in 2006. And this was supposedly one of the most brutal sessions of Congress where they negotiated whether or not Medicare should be allowed to negotiate drug prices. And so before this act, Medicare didn't cover drugs. You had to buy a separate policy to cover outpatient medications. Medicare really only covered inpatient stay and then your doctor's visits as well, but it didn't cover medications. And right around this time, it went from, most of the medications being generic and costing $5 to these higher priced medications. The law ultimately passed that blocked Medicare, and it's a law. Medicare is not allowed to negotiate with drug companies. So whatever the drug company says the price is, that's the price to Medicare, which to me seems a little bit crazy. We took the one body that had some power, some influence in reducing drug prices, and we blocked them, put them out of the negotiation. So the first thing is that Medicare is actually, for the first time in 2025, going to be able to negotiate on drug prices. And the way they did that is they're phasing this in. They're adding around 10 drugs they're adding 10 drugs per year to the list. And they've already released the list for 2025 when this law starts. Ozempic, Mounjaro, there's actually no GLP-1 medications on this list, unfortunately. And so we'll have to see what happens in 2026. Because of all the obesity bias out there, I would not be the least bit surprised if these medications are pushed out for a few years. All right. A lot to talk about, and this is complicated, but I think it's really important for us to kind of scratch away at this every week to see if we can get a better understanding of why these medications are so expensive. Because there's things that we can do. We can join the Obesity Action Coalition. We can reach out to our Congress people. We can follow some of the laws that are out there, and there are some laws that are currently being voted on that may help reduce drug prices.
And it's important, like the more that we can spread this information. I'm learning so much, you know, and I think the more people know, then there's more change that we can help facilitate.
Yeah. All right, let's move on to something lighter. Why don't you talk about our next guest here, Zoe?
All right. Well, we want to welcome Amy. She has been a patient with us for 2 years.
About that, yeah. It's been a while.
Yeah. And so we're really excited to hear from Amy. All right. Well, now we have our incredible patient, Amy, here to share her story. Amy, thank you so much for being here with us.
Thank you for having me.
Yeah, we know you have a long drive, so we appreciate you making the trip.
Thank you.
So first of all, you don't see Amy here. And the reason for that is because Amy is keeping her story about bariatric surgery private. So Amy, who have you told about your bariatric surgery?
My husband.
Who else?
That's it.
That's it. So talk to us a little bit about, let's just talk about the nuts and bolts. Like, how'd that work? Like, you had some time off and there was a recovery and then there was a period of rapid weight loss. Like, how'd you kind of explain that to people? Did people ask, how'd that go? How'd that work for you?
So one thing that worked in my favor was that I had my surgery during COVID. And so I had limited interactions with everyone outside of work. So I didn't really see, for example, anyone outside of my immediate family. So they weren't able to notice the changes. And what I did with work is I was honest. I said that I was going to be having surgery for a hernia repair, which was done at the same time that my gastric bypass was. And so I really just made it about that. And as I began to lose weight, people asked me questions about what I was doing. And what I really focused on was the truth. I was eating mainly protein and vegetables and being intentional with my water intake and my exercise.
If you're enjoying our podcast, please consider joining our online nutrition program. It's just like the podcast, but you get to join in the show. Dr. Weiner, myself, and our peer leaders host over 25 support groups weekly over Zoom and cover all the same topics that you enjoy listening to every week. Whether you're just focusing on nutrition using the Pound of Cure approach, are taking a GLP-1 medication, or have had or are planning to have bariatric surgery, we can help you maximize your weight loss efforts. To join our affordable program for unlimited access to our group nutrition sessions, go to www.poundofcureweightloss.com/nutrition. You can also check the show notes for the link. We hope to see you on Zoom soon.
Fantastic. Yeah, I actually, believe it or not, I have a patient, this is back from my Michigan days, who didn't tell her spouse.
What?
Yeah. She did not tell her, not even her spouse knew that she had weight loss surgery. And she actually pulled it off. So you pulled this off, right?
I have pulled it off, yes.
Yeah. Barely anybody knows that you have had weight loss surgery. And I think this is, I love that you're on the show sharing this, because I think there's a lot of people out there who are afraid of the stigma of weight loss surgery and think, oh, if I want to have this surgery, I want to go through this, but I don't want everybody judging me. And I get it. Like, who likes to be judged? And let's be honest, people will judge. And there's also, though, I think the other side of this is that for every one person who judges, there's going to be 10 people in your corner pulling for you. But I think that the fact that you can go through the surgery and not tell anybody about it, that is totally doable. Yeah. We do that all the time. Patients will give me instructions. Hey, my mom is with me. She thinks this is hernia surgery. Talk to her about my hernia surgery. And my responsibilities to my patient is not to my patient's mother. And so I have no problem with that. I think most surgeons, I'd say probably 98% of surgeons are going to go along with that, no problem. I think from an ethical perspective, it's very clear. Your obligation is to the patient. So you've been able to pull this off. Is there anything else about your decision not to tell people? Is there any unexpected side effects or thoughts that you have about this, or anything happened where you almost got caught? Or
I don't really think that I have had anything like that. What I didn't expect was, so I had surgery with a different provider out of state and had some complications, and then found you about a month after my surgery. And I found the entire community here at Pound of Cure Weight Loss. And so that was the first time where I was able to be honest with anyone about exactly what I was going through. And what I didn't realize was what a difference it makes to connect with people who have lived what you are living, who have had this shared experience. And so that's really one thing that sticks out to me.
Yeah, absolutely.
Our community.
Totally. We've talked about that a lot.
Yeah.
Yeah.
And it's really cool because Amy has been what did you saw her on the leaderboard, right?
Oh yeah, you've attended more nutrition sessions than any of our other 700 members. I know.
Which is amazing because it really speaks to the impact and power in the long-term accountability and the maintenance phase. I talk a lot about, like, we don't want to be in like losing weight phase forever. We want to be in weight maintenance phase forever. But the reality is that that's just as hard, if not harder.
It's harder.
It's harder.
Yeah.
And so having the community and like being empowered to continue to show up for yourself. And I think that that's something that you do really well. And I'm so proud of you for that.
Thank you so much. That accountability piece is just phenomenal with your program. I think it really sets everything apart. And it's a huge reason why I keep my membership with Team Up is I am now 3 years post-op. I have not had any weight gain, and I really attribute that to the two of you and the amazing community that you have built.
Thank you. Yeah, we're actually working on some other pieces to enhance the accountability, to allow for you to kind of set goals and work with Zoe and have some accountability for meeting those goals every week, every month, whatever we work on. So it's great to hear that works, because we put a ton of energy into it. It's not exactly a huge money maker for the practice. There's a lot more money doing the surgery, I'll be honest with you, and that's not what drives us here. But for us, this is what's really important, is making sure that people feel heard, feel safe. And because if you're not emotionally supported through this process, it's so much harder. And you had a rough go with things for a little bit initially, and being able to connect with people makes a huge difference. So we're really happy about that. But we've also, on a more positive note, more practical note, this has changed your family quite a bit. So why don't you talk about some of the things that's changed in your family after surgery?
Sure. So I have several children, and when I had our first kiddos, I was in a lot better shape than I was when I had our last kiddos. And so with our youngest specifically, she's always been in like the 100th percentile for for weight, not height. Yeah. She's about 50th percentile for height. And so every time we go to the pediatrician, it's a really big issue. When kids have that kind of growth on the growth chart, even though they're really young, they order all kinds of labs like cholesterol and sugar. She has to fast for the labs. And so it just made me really sad that I felt like I had set kind of my first kids up for success by prioritizing my health. But I gained a lot of weight with each pregnancy. Yeah. And then with our youngest kiddos, I didn't do that. And so I was having just a lot of mom guilt, honestly, about that. And I really wasn't sure how to change it. I had asked our pediatrician, who's amazing, and she basically said, eat less, move more type of advice. And so over the summer, I was very nervous about the youngest gaining weight, because I thought, oh man, we don't have the structure of school. She has access to food all day long. What is this going to look like? And I leaned on the Pound of Cure book, and I took that principle and created the veggie drawer at home. So what we do is we prep several different vegetables for the kids to access. And really, I made it for our youngest. But of course, our older kids, they have access to this too. And so what it is just several vegetables. Some of them they choose, some of them we choose. We prep them, we put them in the fridge, and they can get anything from the veggie drawer at any time, no questions asked. So it could be 2 minutes before dinner. It could be right after school. It might be our youngest's favorite is 1 minute before bedtime. But we decided
smart kid.
We were never going to say no to the veggie drawer. And what happened over the summer was our older kids, they gained weight over the summer. It wasn't excessive, a few pounds, but our youngest actually lost several pounds. And so when we went to the pediatrician, she asked me right away, what did you do? What we don't usually see, BMI come down like this in kids. And so I explained everything, and she really was so happy that her health is improving.
That's awesome. Good job, Mom.
Yeah,
thank you.
Oh my
really
God.
Good idea. And what I love about it too is it puts some of the ownership in the kids' hands too. Like when they get to pick out the veggies, they want to be independent. They want to make those choices. And so it really kind of puts the power in, you make them think that they've got the power.
Yeah. Wow.
One thing that I would like to share too is it really has empowered her to make really healthy choices outside of home. And so sometimes, as we know, with life happens, we have to go out to dinner, and she is the first to order a salad, and she'll order that salad, just vegetables and protein. She doesn't use any dressing, and she's even been complimented out for being a kid who's in public eating a salad.
Yeah. I think there's some other really important things that are happening by doing this. How old is she?
She is 5.
She is 5. So her genetics are not finalized. And that's something we kind of think, oh, when the sperm and the egg comes together, boom, that's your genes. But that's not how it works. There's this whole thing called epigenetics. And epigenetics is this process where our environment turns on and off certain genes. And so when we're exposed to highly processed, highly palatable foods, it's going to turn on genes that promote weight gain. When we're exposed to lots of vegetables, we're going to turn on genes that cause weight loss. And so at 5 years old, that epigenetic process is still developing. It's still in place. It's probably in place for a couple more years. And so when you're getting your children, your young children on these eating a lot of vegetables, you're helping to turn on genes that are going to help them with their weight maintenance for the rest of their life. So, there's never an age that's too young, obviously, assuming they can eat the vegetables safely. But I love what you've done. What a great story. I think what a great example also of positive parenting. Because with those veggies, whenever they ate the veggies, I'm sure there was lots of positive reinforcement that came along with it, where so much of dieting and so much of treatment of childhood obesity is don't eat this, don't eat that, restrict yourself, you're bad if you want to eat these foods, when you focused on the positive side, which is so helpful for kids.
Focusing on what you can add, not what you have to take away.
So I love this story. What a great story. Amy, I think you're an inspiration. Your weight loss success, I think the way you've managed your decision about surgery is really been fantastic, and you made it work for you. And then what you've done to kind of spread some of this healthy eating to your children is amazing. And then for being such a valuable part of our community.
Yeah. We love you, Amy.
Thank you.
Absolutely.
I love you guys.
All right. Very good.
Fantastic.
Well, that was so awesome. Thank you, Amy, for being here. And I hope that everybody listening got some good nuggets of information. Now, my nutrition segment has to do with something similar, right? Making vegetables more convenient to eat. One of the number one barriers that patients tell me about when trying to increase their vegetable intake is the time, is the convenience, right? It's not convenient for many people to, I've got to cut up in this bell pepper, right? You got to take out the seeds, you got to do this, that, and the other. And then it's ready to have as a snack or put into your eggs. And so it's that time barrier that we need to break down. And so a little hack that I recommend has to do with prepping. So some people love to do their meal prep Sunday, dedicate meal prep. That's amazing. For a lot of people, meal prep has to look different, and that's okay. So prepping your vegetables can be a huge time saver and making it more convenient. So this is my challenge for you, is to, when you get home from the grocery store, don't put away your veggies. I want you to put away your other groceries, and then you're going to take 10 minutes, wash and chop your veggies, put them in Tupperware containers. They're clean, they're ready to be added to salads, grabbed as a snack, added to your eggs, wherever you want to have your veggies, and put them at eye level in the refrigerator. That bottom drawer where the veggies go, maybe you have the best of intentions. You buy a bunch of veggies and you put them in that bottom drawer. And then when it comes time to actually eat them, a lot of people say, well, they end up going in the trash because it's, they don't have the time, the convenience, and then the vegetables die. So do yourself a favor, take out 5, 10, maybe max 15 minutes, get your veggies ready to go, make them convenient, have them as a snack, add them to meals.
I love that. That's a fantastic idea. I think it gets back to some of the things we talked about in the past shows about your food environment, right?
Absolutely.
When you open the fridge, the first thing you're seeing are the veggies. There's not an obstacle. There's not a barrier to you choosing those as your snack as opposed to something else. That's one of the reasons why chips and other highly palatable foods are so frequently eaten, is that you just grab the bag, open it up. I mean, you can pretty much have, half the handful in your mouth before you even recognize the conscious decision you just made to eat.
Yeah.
So you're really kind of putting vegetables on par with chips and cookies and other packaged foods and making them just as easy to eat.
Exactly.
Love it. All right. So fantastic tip, and really helps you kind of syncing that as well with Amy's discussion about the veggie drawer for the kids can be a great way to make sure the kids have that available. So we're going to kind of shift back to our topic and extend a little bit more about drug prices. And we're going to talk today about, on our economics of obesity segment, we're going to talk about pharmacy benefit managers, also known as PBMs. And again, getting a straight answer on exactly how PBMs are priced and what role they play in medication acquisition, in prescription coverage is very difficult. PBMs, you've heard of them before. These are companies like CVS Caremark or Express Scripts by Cigna, OptumRx, which is owned by United, and then Humana Pharmacy, which is owned by Humana. So what's happened is all of the big insurers have gone out and purchased these pharmacy benefit managers. So again, they control every single part of the prescription drug cost except for the pharma industry, the manufacturing of the medications. After it's manufactured, they essentially control everything until it reaches your hands, your insurance, all of that stuff. So a PBM or pharmacy benefit manager sits between the pharmacy and the insurer, and they are the ones who come up with the formulary. So every time you go online and you say, okay, hey, is Wegovy covered? Is Mounjaro covered? What are the criteria? These are rules that are created by the PBM. The role of the PBM is to lower the prices. And these things have been around since the 60s, and they would work with the insurance company, and their job was to go out to the pharmacies, to go to the pharma industry and say, hey, let's talk about the cost of penicillin. We're buying a lot of it. We represent 10,000, 100,000, a million people. Now these PBMs are representing, 20, 30 million people. Mm-hmm. And we want the price to come down. And so that's what the role of the PBM is supposed to do. But in fact, that's not how it works. So the big issue is, and something we've found time and time again, not just in medicine, but anywhere in economics, is when profits are linked to a certain behavior, we get more of that behavior. Mm-hmm. So there's two components to PBM pricing that misalign the PBM profits and lower drug prices. And the first is something called price spread. And so what happens is the PBM goes out to Walgreens and the drug manufacturer, and it's a very complicated relationship because they negotiate both with the drug company and with the pharmacies. And so let's say that they say, okay, this drug we're going to cost $100. And what they then pass on to the insurer is not $100, but $100 plus 10%. So it's a percentage. And this is called a price spread. So they're paying the pharmacy $100, but they're charging the insurance company $110. Now, technically, the insurance company and the PBMs are separate entities, but they are owned by the same corporation. And it just allows them to they both get to profit in this instead of, having to potentially share the cost reduction. Mm. So let's say the drug now costs $200. They get to keep $20. And so the higher the drug cost,
more profits they make.
The more the profits they make. And in fact, this is an underlying theme that pervades not just the prescription industry, but much of healthcare. And that explains so many reasons why our healthcare costs are increasing, is that the people who are supposed to be working to lower our healthcare costs don't benefit from lower healthcare costs. And so until we get the employers, because the employers are who pay the majority of healthcare, it's practice, like our practice. We pay for a percentage of our employees' healthcare, and that we're paying this cost. Large employers pay for tens of thousands of people's healthcare. And they can either be paying in the form of premiums like we do, but larger employers are what are called self-funded, which means they actually pay for each healthcare transaction. So the employers are paying for this, but they don't really get to sit down and help reduce the cost. It's the insurance companies, and we see that the insurance companies make more money as healthcare costs go up. So the second component that is extremely opaque about this process is about rebates. So typically, when you purchase something, let's say you're in a negotiation, we say, okay, I want to pay $100 for the drug. And the manufacturer goes, what about $200? And you say, okay, well, normally you would say, well, let's settle on $150. Mm-hmm. But that's not how it goes in these negotiations. Instead, they say, okay, how about this? It's $200, but at the end of the year, we'll give you a $50 rebate. Guess who keeps the rebate? The PBM.
Oh my gosh.
They don't pass that rebate back to the insurance company, back to the employers, back to the Medicare recipients, back to the people who are paying for the insurance. And so they say, oh, well, the drug cost $200, but it didn't because they got that rebate at the end. And so this price spread and these rebates prevent us from really getting an accurate determination of the cost of a medication. And they make it so that there is an incentive for the PBMs to keep the drug prices high, and they're the ones involved in the negotiation. But there's hope. So first of all, there are 2 laws that are currently going through Congress, and I would encourage everyone to reach out to their congressperson and suggest that they vote for these laws. And so the first is Protecting Patients Against PBM or Pharmacy Benefit Manager Abuses Act. And there's another act called the Patients Before Middlemen. And these acts only apply to Medicare, so they don't apply to commercial policy. But they essentially have forced the PBMs to only charge a flat service fee. So for every member, they can say, okay, it costs $20 a person to participate in our prescription plan. And that's the only way they can make money. It prevents the spread pricing, so there's no ability. If they pay a pharmacy $200, they got to charge the insurance company $200. They got to charge Medicare $200. Mm-hmm. There's no hidden service fees, and there's no percent charges based on the cost of drugs. Because again, the higher the cost of the drugs, the higher the percent return for the PBM. And so these laws are actually really helpful and favorable and will bring down costs for Medicare. They do nothing for commercial policies, but so much in healthcare is linked to Medicare. So as we get more of this in place for Medicare, the commercial plans are going to be able to say, hey, I want that too. Some other really great things are happening. There's Mark Cuban Cost Plus Pharmacy. And he is extremely transparent through this program, and they sell only generics right now, and they are a tiny, tiny, tiny piece of the prescription puzzle. I mean, they're far less than 1% of all the prescriptions that are sold. But it's very clear. You want this drug? Well, this drug, we bought it for $80. We're going to charge 15%. That's what they charge, a 15% plus shipping and handling fees, and it is just right there on the list. This is our cost. Here's our 15% markup, here's your shipping and handling fee, and here's your cost. And we're seeing drugs for half, a third of what you'll get from CVS and from Walgreens. We see something similar with GoodRx as well. But of course, the PBMs are onto this. They see this cost plus model as being really well received by the public.
Of course.
Of course. And so now we've got CVS CostVantage and CVS Caremark True Cost. So these are the PBMs coming out with their own version of this. And honestly, they're not stupid. They see what's happening. If I can see it, believe me, they see it too. They know what's happening. They know they're going to have a lot of attention paid to them. They know they're going to have some limitations in their ability to profit the way they have been. And so they're trying to come up with their own solution. But in many ways, this is like giving the fox the keys to the henhouse. If we count on the PBMs to change their payment model, we're just going to get more of the same. And it's really important that this comes from outside of the insurance industry. All right, I've talked a lot about drug prices. I think it's time to move on.
Okay. So now we'll move on to our listener and social media subscriber submitted questions. Sierra, you want to go ahead and read off our first question?
Sure. Okay, so first question is from our YouTube video from episode 8, Paging Dr. Lily. And this question is from Angela. Hi, I had a sleeve 4 years ago. I was losing weight for a year and a half, kept it off for another year, and I'm gradually putting on weight ever since. I've gained 10 kilograms. I'm doing CrossFit 5 times a week and eating pretty well, but I feel my body is craving more food, so my calorie intake increased. I'm worried the increase will never stop. Is my only option to go on meds?
All right, Zoe, first, why don't you talk a little bit about her strategy for weight maintenance She's now 4 years after a sleeve.
Yeah. Well, I mean, even though I'm not the biggest fan of CrossFit, I'm glad she's doing, structured exercise, both cardiovascular and strength, like we've talked about before. However, it's really important to keep in mind with the significant exertion weekly with exercise, her body needs that extra fuel, and clearly it's asking her for it.
Yeah.
So my philosophy is, if your body is craving more food, we want to give it more food.
Absolutely.
It's just a matter of what you're giving it.
Yeah. And I think, but the important piece of this question is she's gained 10 kilograms, 22 pounds. Mm-hmm. And so there's a lot of conversation about CrossFit and eating pretty well. And, what are your thoughts on exercise versus nutrition in terms of the efficacy of weight loss and weight maintenance? Which is more important?
Nutrition, for sure.
By a factor of 5?
Right. I'm sure everyone has heard the phrase, you can't out-exercise a bad diet.
Absolutely.
Right. We want exercise to build muscle and, maintain your metabolism. But the reality is that if the nutrition isn't there, it doesn't really do a whole bunch of good.
I think I see this over and over and over again in people who are really exercising a lot, is that the nutrition often falls off. And I think truthfully, you're much better off if you are eating well and exercising a little less than the opposite. And so my suspicion is that the first thing that I would do if this person was in my office would be to get them on the metabolic reset diet, to get them working through the nutrition program with you, really dialing in the nutrition. And if you need to scale back the exercise to reduce some of the hunger and the cravings for processed foods, to me that would be worthwhile, especially CrossFit, which is kind of the most intense of all exercise forms. I'm not saying give up exercise, but certainly reduce it if necessary and make sure that the nutrition is dialed in.
Well, and also kind of doing a little bit of tweaking and work. Obviously, we don't have a whole food history, but, making sure that her nutrition around those exercise bouts pre and post are optimizing that exercise as well, making sure she has the energy to get through it so that later on she doesn't have more cravings.
Right. I think if the nutrition is dialed in and the exercise is dialed in as much as you're capable of, then the answer to whether your only option is to go on meds, it probably is. It's either that or tolerate the weight gain. And that's, personal decision, one you can make with your doctor. I think the meds work really, really well for weight regain after bariatric surgery. Mm-hmm. And this is something we're actually looking at putting together and getting some hard data on, because we have a tremendous amount of experience treating weight regain after sleeve gastrectomy, particularly in our practice. And we see great results with this. We're going to talk in future episodes. We actually have some really interesting guests coming on who have managed to maintain their weight after treating it with their weight regain after a sleeve. They've maintained it with meds, but they use a very novel dosing strategy. Mm-hmm. And so I think there is some opportunity that it doesn't have to be this once a week, every week kind of thing. There's some opportunity to come up with some creative dosing strategies where you may not be as reliant on the med as you think you have to be.
All right, next question.
Okay, next question is from Raphael from our website. How can I stay on track with my nutrition while traveling during the first few months after weight loss surgery?
Great question. And I actually talk with patients all the time about really making sure that they have good tools and strategies while traveling, and especially those first couple of months after weight loss surgery, priorities being fluid and protein. And so my main thing is, if you're flying, bring an empty water bottle with you through security, fill it up, make sure you have your fluid. You don't need to buy a $7 bottle of water.
No.
But then also, whenever it is that you're getting to where you're going, hit the grocery store or, some sort of place that you can have those food items, those snacks, those protein sources that you have been relying on before traveling, ready to go. Packing some snacks with you, such as nuts, such as, you can have your protein shakes. Obviously you can't travel with Greek yogurt and vegetables, but making your grocery stop after you're getting where you're going can be really helpful.
Yeah. What are the rules about bringing protein shakes through TSA? I don't think you're allowed to, right?
Well, if you have sealed, shelf-stable, ready-to-drink protein shake like a Premier Protein in your checked bag,
Right.
that's fine. I have taken protein powder through the security.
Yeah.
I have definitely gotten searched every time. I'm like, I promise it's just protein powder. You can get through. Oh my gosh,
The dogs are there, you know, it's always getting everything wiped down.
It's clean. But no,
maybe take the chocolate, not the vanilla.
Right. So, you know, definitely putting a little bit of extra time and planning into making sure that you are prepared, and don't really worry about being looked at weird if you have to go to the grocery store while on vacation.
Yeah.
You know, you don't have to eat out every meal.
Instacart too.
Yeah, definitely.
Yeah. Okay, last question, Sierra.
Okay, this one's from Sharon from the website. I've heard a lot about metformin recently. What do you think?
Yeah, people talk a lot about metformin. I love the cost of metformin. Metformin is like $5. That is the only thing I like about metformin, unfortunately. It causes a lot of GI side effects and extremely little weight loss. Every now and then, we'll see someone have some modest weight loss from metformin. But in general, we're looking at 3 to 4 pounds if you continue to take this medication that makes you feel lousy. Essentially, I think this medication works by making you feel nauseous and giving you a GI upset, and that discourages you from eating a little bit. But I don't think it does anything metabolically to drive weight loss the way the GLP-1s do. So it is a reasonable option for someone. Well, it's not really a reasonable option for anyone, honestly, in my opinion. I wish it was because of the cost, but it just doesn't work, unfortunately.
Yeah, well, sounds like that's that.
Yeah.
Well, that wraps up another show. Happy to have you guys here listening with us. And as always, be sure to subscribe to our podcast so we can continue climbing in that ranking and also delivering science-backed information about your weight loss journey here to you for free.
That's right, without judgment.
Right? Exactly. Make sure you give us a follow on social media, all of your favorite platforms at A Pound of Cure, our nice new sign, which we're super excited about. And we'll catch you in the next episode.
See you next time.
Thank you for listening to the Pound of Cure Weight Loss Podcast. We'd love to hear from you on your favorite social media platform. Check us out at A Pound of Cure. If you're in Arizona and would like to become a patient in our practice, please call our office to schedule either an in-person or telemedicine appointment.